Well, this is actually a very successful conference. This is the second year we do it. We provide an educational activity on cardiovascular management for nurses and ICU nurses.
This conference is unique because it was put together by representatives from all over the system, and it was a multidisciplinary approach between nurses, physicians, folks from the Research Institute, so that we could reach all of the nurses within the system as well as nurses from other hospitals in the area to make sure that, again, we're keeping up with evidence-based practice and providing the best level of care for our patients.
What makes this conference unique is the people attending it. I mean, you have some very sharp, qualified nurses here that want to expand their knowledge and know more about what's going on underneath the skin, so to speak. What's that heart really look like? And this is a chance to sort of get a view of that.
I think this course is important for us as nurses because it's different. You get the chance to see like the anesthesiologists, the doctors that we usually work with, just kind of as a whole. You may hear their name, but just to be able to see that person and to kind of get their take on different things here at Methodist, I think it was very important.
Continuing education is extremely important. This is a fast-moving, fast-evolving specialty. A lot of new innovations, technologies that are being brought in on a daily basis, and if we're not constantly pushing the envelope, understanding those, incorporating those into our practice, it's hard to drive outcomes without it.
It's important in general just because, from my point of view, especially being a nurse and stuff like that, education never stops. We're always learning something new. This conference itself, I'm learning a lot of stuff that I didn't know or even think about, but it's just part of what the process is when it comes to working as a bedside nurse. Things are always changing in medicine, being up to date with new things and new trials that we can possibly do, and especially when it comes to being able to benefit the patient, because that is the #1 thing for us. It's always going to be what is beneficial for the patient.